My name is Dee Wilson and I'm a midwife for 15 years and I'm currently a clinical fellow with Health Education England. I'm here to speak to you today about the National Education and Training Survey, or NETS for short, and to ask for your support. But first, I want to talk to you about Health Education England, who we are and how we support students like you whilst you are completing your training programme. Whilst I'm speaking to you, you can use the QR code on the screen to complete the survey on your phone or other smart device. It should only take about 10 minutes. Health Education England exists to help improve the quality of life, health and care services for the people of England. We do this by ensuring the workforce of today and tomorrow has the right skills, values and behaviours in the right numbers, at the right time and in the right place. Our goals are to produce the best possible future workforce, to transform the current workforce to meet tomorrow's needs, and to ensure the quality of training as you make your way through your education programme. To do all of this, we need your help. Each year, HEE runs the NETS. It's the only national survey which is open to all of you who are completing a practice placement or training post in healthcare as part of your education and training programme. The survey gathers your opinions about your time working and training in clinical learning environments, asking you to share your feedback on what is working well and what you think could be improved. The survey is currently live and will remain open until midnight on the 30th of November 2022. If you've already opened the survey, you'll see that you're presented with a questionnaire. This will be the same for each of you, asking you questions about key areas of your learning, such as induction, clinical supervision, facilities, learning opportunities and teamwork. We will also ask you questions which focus on your health and well-being, experiences of equality, diversity and inclusion, and your experiences of being a student in your professional areas. Your responses to the survey are confidential and we only produce results from data that completely protects your anonymity. Now, you might be thinking that this is just another survey that you're being asked to complete, and what difference does it make if you complete it or not? Well, we use your responses and the feedback you provide us to inform the decisions we make about quality within the learning environments. We talk about the results that we've received from you with universities and placement providers to inform any areas of concern that we may need to action, or areas of good practice which we can celebrate and share with our colleagues. For example, since the last NETS survey was completed in November 2021, HEE have undertaken 22 visits to placement providers across the Midlands in response to the feedback that learners like you have shared with us, and to offer support to those providers where potential concerns have been identified. As well as visiting our placement providers, HEE recognises that it may need to provide support to wider programme groups on a national scale. We're currently undertaking a review of the paramedic programme to understand the impact that the current clinical learning environment has on learners and to support improvements for our future paramedic workforce. We are doing this using a thematic review, as this is currently the best way for us to get direct feedback from paramedic students. Last year in the Midlands, we saw that only 247 midwifery students told us about their learning experiences through the NETS, and likewise 751 nursing students gave us their feedback on what it was like to be training in 2021, working on the ground, caring for patients and getting their curriculum competencies completed along the way. This is a very small sample of students sharing their thoughts with us on what their learning is like, and we need to see improvements in the rate of responses across all students so that we can really understand what it's like for you whilst you were completing your training on placement. Your responses really do count towards improving the learning environment and celebrating what's already great about it. It helps us to support staff in developing the right skills, values and behaviours to deliver high quality patient care. If you would like to read some further information regarding HEE or the NETS, please type NETS HEE into Google and click on the link. You'll find a number of resources on our website, including frequently asked questions and results from previous surveys. Thank you so much for listening and for your support in completing the NETS, and good luck in all your training.